In one of my videos, I spoke about how sugar does not directly cause diabetes. And yes, that is true. Sugar intake does not directly cause diabetes, but can be a risk factor to developing diabetes. In one of my comments, someone asked, how can insulin become active again? Well, apart from the medical method, which is to rejuvenate the pancreatic cells, or to help the pancreas, that's the organ that helps to produce insulin, to become active again, which is administering metformin or doing insulin therapy. Apart from that, there are actually different methods that you at home can do to increase or improve insulin sensitivity. And yes, these are things that have actually been proven to work over time. One of the most important ways is intermittent fasting. I mean, this has been a game changer over the years, over several researches, over several studies. They've shown that intermittent fasting can actually improve the insulin resistance and can improve the rate at which your muscles absorb blood sugar. So in intermittent fasting, you need to know how it works. You need to know when to fast. You need to know for how long. There are different types of intermittent fasting. You do the 12:12. That is, you fast or you eat for 12 hours. Between that 12 hours window, and fast between the 12 hours window. It is actually advised to eat from morning, that is from 8 a.m. till 8 p.m. and anything from 8 p.m. do not take any other thing apart from water. So that is the 12:12 intermittent fasting. Another one you can actually do is the 16:8 intermittent fasting, where you eat between the 8 hours window of the day, and after 8 hours you don't eat for the remaining 16 hours of your day. That is if you've already mastered the 12:12 before moving on to that. And there are other intermittent fasting method. I'll do a video to explain intermittent fasting in details, and that could be helpful to somebody. Another method to help insulin sensitivity is exercise. I mean, nobody can actually rule out exercise from gaining a healthy life, to losing weight, to becoming more fit, and also in helping blood glucose. Exercise is a game changer, but you need to know when to exercise and what kind of exercises to do. We have the HIIT, which is the high intensity interval training. These ones help to actually absorb blood glucose into the muscle as faster than any other method. So if you are doing your exercise, hi boy, if you're doing your exercise, ensure that you are doing it after meal, after eating. That is in the case of when you are trying to reduce your blood glucose levels and not trying to just lose weight or lose fat. No, when you're trying to reduce your blood sugar levels, it's important to do those exercise after meal, at least 10 minutes, 15 minutes. Exercises such as immediately after eating, take a 10-minute walk, move around. Don't be sedentary. Don't have a sedentary kind of lifestyle. You move around. And if you're talking about older people that are advanced in age, and you're asking, oh, what kind of exercise can these people do? They can do walks. They can do leg raises. Yes, you can sit in a position, then lift your legs for a particular amount of time. So you can also do squats. So for seniors, that's for older people, they can take walks. If they can swim, yes, they can swim. And exercise is always a game changer. Exercise is always a game changer for improved insulin sensitivity. Another game changer to improve insulin activity, to improve insulin sensitivity, is weight loss. Weight loss is actually one of the game changers. And this weight loss, what happens in weight gain is that the fat clogs the GLUT4 transporters. There is a transporter that helps to absorb glucose into the muscle. So this fat tends to block those transporters, and also fat tends to increase the inflammatory cytokines in the body. So in that case, you are having issues absorbing glucose, you're having issues absorbing glucose into your muscle and using up glucose. So exercise, weight loss, intermittent fasting, and lastly is avoid carbs. Avoid food that are so high and rich in processed sugar. Those ones will only add to sugar in your bloodstream, and you know your pancreas is already doing a whole lot of work to try to produce insulin, and when you are increasing the sugar intake in your body, it's going to be a whole lot of work for the pancreas. It's going to be a whole lot of work for the pancreas. So to curb out glucose, to help your body to increase insulin activity, is number one, increase exercise, intermittent fasting, reduce carbs. There are several lists of foods that you can actually incorporate into your meal. There are several kinds of food that you should stop eating as well. I'll probably do that in another video, but you should reduce processed sugars and stop taking fizzy drinks. I'm not saying reduce, I mean stop, because you are trying to control your sugar level and also increase insulin activity. If I've been able to answer your question and if I've been able to help, please let me know in the comment section, and I will definitely be so glad. If you found this video helpful, please do share it, and I'll see you in subsequent videos. Au revoir.